Have you ever been told that your vitamin B12 is too high? Maybe your doctor looked at your blood test and said your levels are elevated and you should stop taking your supplements. Or maybe you went for a routine checkup. Everything looked normal on paper, and yet you still feel exhausted every single day. You wake up tired, your memory feels foggy, your legs feel heavy, and nobody seems to have an answer for you. That feeling is real. And today, I want to talk about why it happens and what you can actually do about it. Here is something that might surprise you. Around 40% of people over the age of 60 are deficient in vitamin B12. That is not a small number. That is nearly half of all seniors walking around without enough of one of the most important vitamins the human body needs to function. And the truly troubling part is that many of them have no idea. Their lab results come back, the doctor says everything looks fine, and they go home thinking they are healthy. But fine on paper is not the same as feeling well in real life. My name is Dr. Alina Saratia, and I have spent years working closely with patients, especially older adults, who come to me frustrated, exhausted, and confused. They have seen multiple doctors. They have had multiple tests. And yet, nobody has sat down with them and explained what is really going on with their B12. So today, I am going to do exactly that. I am going to answer two very important questions. How much B12 is too much? And are you actually getting enough? By the end of this, you will have real, practical guidance that you can take into your own life. Before I get into the numbers and the science, I want you to understand why B12 matters so deeply. This is not just another vitamin on the shelf. Vitamin B12 is involved in some of the most critical processes your body performs every single day. It plays a major role in your energy production. When your B12 is low, your cells cannot make energy efficiently, and you feel it. That deep, heavy fatigue that does not go away even after a full night of sleep. That is often B12 deficiency showing itself. B12 also supports your brain in ways that are incredibly important as we age. It helps improve focus, supports a stable mood, and keeps your mind sharp. It is involved in producing red blood cells, which means it directly affects how much oxygen reaches your brain and every other organ in your body. When your brain is not getting enough oxygen because your red blood cells are not being produced properly, you feel mentally slow, forgetful, and emotionally drained. That is not just aging. That is often a fixable problem. And then there is the nervous system. This is the area I want you to pay very close attention to. Vitamin B12 is essential for maintaining the myelin sheath, which is the protective coating around your nerve fibers. Think of it like the insulation around an electrical wire. Without that insulation, signals do not travel properly. You can experience tingling, numbness, burning sensations in your hands and feet, weakness in your legs, and even balance problems. These are not small complaints. These symptoms can seriously affect your quality of life and your ability to stay independent. Now, I want to ask you something personally. Are you currently taking a B12 supplement? If yes, what dose are you taking? Is it 200 micrograms, 500, 1,000? Many people take whatever comes in their multivitamin without ever questioning if it is the right amount for their specific body and their specific needs. And that is completely understandable because nobody ever sat down and explained it clearly. So let us change that right now. One of the most common things I hear from patients is that their doctor told them their B12 was too high or that their levels are normal. And this creates a tremendous amount of confusion. They do not know whether to keep supplementing, whether to reduce their dose, or whether to stop altogether. Some people stop entirely out of fear, and that is when I start to see real problems emerge. So I need to clear up this confusion once and for all, and it starts with understanding two very different concepts. The first concept is the Recommended Daily Allowance, which most people have heard of. The RDA for vitamin B12 is 2.4 micrograms per day. That sounds like a reasonable number until you understand what it actually represents. The RDA is not about thriving. It is not about feeling your best or protecting your brain or supporting your nerves at the highest level. The RDA is the absolute minimum amount needed to prevent a deficiency disease. It is the floor, not the ceiling. It was never designed to help you feel energetic, mentally sharp, and physically strong. The RDA also does not take into account anything about your individual life. It does not consider whether you smoke or drink alcohol, both of which significantly increase your body's demand for B12. It does not account for your stress levels, how much you exercise, whether you have any chronic health conditions, or critically for those of us over 60, how much your body's ability to absorb B12 has declined with age. And that last point is enormous because it affects nearly everyone reading this right now. As we get older, our bodies produce less of a substance called intrinsic factor, which is made in the stomach and is absolutely necessary for B12 absorption. Without enough intrinsic factors, even if you eat foods rich in B12 every single day, your gut simply cannot pull it out and use it. This is why seniors can be severely deficient in B12 even when their diet looks perfectly fine. The food is there. The vitamin is there. But the body cannot absorb it the way it once could. This is biology, not failure, and it means that older adults need significantly more B12 than younger people just to absorb the same usable amount. So now, let me introduce you to the second concept, and this one is going to change the way you think about vitamins entirely. It is called the optimal daily allowance, or ODA. Unlike the RDA, the ODA is about thriving. It is about giving your body not just enough to avoid disease, but enough to actually function at its best. For vitamin B12, the suggested optimal daily allowance is around 10,000 micrograms per day. Now, I know that sounds like an enormous number compared to the 2.4 micrograms of the RDA, and it is. The gap between survival and optimal health is that wide. Let me give you an analogy that I use with my patients all the time. Imagine your body is a car. The RDA gives you just enough fuel to keep the engine idling. The car is technically running. It has not stalled, but it cannot go anywhere. You cannot accelerate. You cannot handle hills. And the engine is under enormous strain, just maintaining that bare minimum. The ODA, on the other hand, gives you a full tank. The engine runs smoothly. You have power when you need it, and the car can take you wherever you need to go. That is the difference between surviving and living well. And now I want to address the fear directly, because I hear it constantly. Is it dangerous to take that much B12? Will high levels cause harm? The answer, backed by decades of research and clinical use, is no. Vitamin B12 is water-soluble, which means your body does not store large amounts of it in fat tissue the way it does with fat-soluble vitamins. Whatever your body does not need at that moment gets excreted through your urine. It literally passes out of your system. This is why there is no known toxic upper limit for B12 established by any major health organization in the world. In clinical studies, doses of 10,000 micrograms and even up to 60,000 micrograms have been used safely in patients being treated for specific medical conditions. These were not reckless experiments. These were supervised, published medical studies. And none of them did high B12 doses cause serious harm. The vitamin simply does its job, and the excess leaves the body naturally. So the real danger with B12 is not taking too much. The real danger is taking too little and letting deficiency quietly damage your nervous system, your brain, and your energy levels over months and years. Now, some people need even more B12 than the average person, and I want to be very specific about this. If you are under chronic stress, your body burns through B vitamins at a much faster rate. If you are dealing with persistent fatigue, that is often a sign your body is already depleted. If you consume alcohol regularly, or if you smoke, both of those habits directly interfere with how your body absorbs and uses B12. if you have any cardiovascular concerns or neurological symptoms, your need for B12 is elevated significantly above the baseline. There is also something critically important that most patients do not know. Several very common medications actively deplete vitamin B12 in the body. Metformin, which is widely prescribed for type 2 diabetes, is one of the most well-known offenders. Proton pump inhibitors, the medications used for acid reflux and heartburn, reduce stomach acid in a way that interferes with B12 absorption. Even aspirin, which millions of older adults take daily for heart health, and certain blood pressure medications have been associated with lower B12 levels over time. If you are on any of these medications, your need for supplemental B12 is not optional. It is essential. I want to spend a moment talking about nerve damage specifically, because this is where I see the most severe consequences of long-term B12 deficiency, and it is where higher doses make the most dramatic difference. When the myelin sheath around nerve fibers deteriorates from lack of B12, the resulting condition is called peripheral neuropathy. Patients describe it as burning, tingling, numbness, or a feeling like their feet are wrapped in cotton. Some have trouble walking steadily. Some cannot feel temperature properly. It is a deeply uncomfortable and often frightening condition. The key thing to understand about nerve repair is that rebuilding damaged tissue requires far more resources than simply maintaining healthy tissue. Think of it this way. Painting the walls of a well-maintained room takes very little effort and very little paint. But if those walls have been damaged, cracked, and peeling for years, you need to strip everything down, patch the damage, prime the surface, and then paint. The amount of material required is many times greater. The same logic applies to your nerves. Patients with established nerve damage often need doses in the range of 60,000 micrograms in clinical settings to see meaningful repair and recovery. So let me now give you clear, practical guidance on what I recommend for different situations. For someone in generally good health who simply wants to support their well-being and protect their brain and nerves as they age, a dose of 1,000 to 2,000 micrograms per day is a solid starting point. For someone who is taking medications like metformin or proton pump inhibitors, I recommend bumping up to 2,000 to 3,000 micrograms per day to compensate for what those medications are depleting. For someone experiencing symptoms like fatigue, brain fog, mood changes, or early numbness and tingling, I typically suggest starting at 2,000 to 5,000 micrograms per day. And for someone with established nerve damage or neuropathy, working with their doctor toward higher therapeutic doses in the 2,500 to 3,000 microgram range or above is often appropriate. Now, not all B12 supplements are created equally, and this part matters a great deal. There are 4 main forms of B12 you will find in supplements. Cyanocobalamin is the synthetic form and the most common in low-cost multivitamins. It does work, but your body has to convert it before it can use it, which adds a step. Methylcobalamin is the active form, meaning your body can use it immediately without conversion. This is the form I recommend most strongly for older adults. Hydroxycobalamin is a natural form that stays in the body longer and is often used in injections. Adenosylcobalamin works alongside methylcobalamin inside the cells, particularly in the mitochondria, where energy is produced. If you can find a supplement combining methylcobalamin and adenosylcobalamin, that is an excellent choice for overall B12 support. How you take your B12 matters just as much as which form you choose, especially as you age. Because of the reduced intrinsic factor I mentioned earlier, regular oral tablets that you swallow may not absorb well enough to make a meaningful difference. Sublingual B12, which is a tablet or liquid that dissolves under your tongue and gets absorbed directly into the bloodstream through the tissues in your mouth, bypasses the digestive system entirely and delivers the vitamin much more efficiently. I recommend sublingual forms for most of my older patients. Taking your B12 in the morning is ideal because it supports energy production throughout the day. If you prefer to swallow a tablet, taking it with a meal can help with absorption and minimize any potential digestive sensitivity. For people with very severe deficiency or significant nerve involvement, injectable B12 is the gold standard. Injections deliver the vitamin directly into the bloodstream with 100% absorption, completely bypassing any issues with the digestive tract. If your symptoms are significant and oral supplementation has not been giving you the results you need, a conversation with your doctor about B12 injections is absolutely worth having. I also need to talk to you about your lab results, because this is where so much confusion happens. When you get your B12 tested, the standard reference range your lab uses is typically 200 to 900 picograms per milliliter, and most doctors will tell you that anything within that range is normal. But normal is not the same as optimal. In my clinical experience, patients do not start feeling genuinely well, with good energy, clear thinking, and stable mood until their B12 levels are in the range of 600 to 1,000 picograms per milliliter. The lower end of normal is simply not enough for most people to thrive. There are also two additional tests that I find far more useful than a standard B12 blood level. The first is methylmalonic acid, often abbreviated as MMA. When your body is functionally deficient in B12 at the cellular level, MMA builds up in the blood, and elevated MMA is one of the earliest and most sensitive signs of true B12 deficiency, even when the standard blood level looks normal. The second test is homocysteine. High homocysteine is strongly associated with cardiovascular risk, cognitive decline, and nerve damage, and it is directly related to inadequate B12, along with folate and B6. If your homocysteine is elevated, that is a red flag that your body is not getting enough B12 to carry out its essential functions, regardless of what your standard B12 number says. Now, let me address one more concern before I give you your action plan. Are there any side effects from taking higher doses of B12? The honest answer is that most people experience none whatsoever. One of the most common things people notice is that their urine becomes bright yellow. This is completely harmless and is simply your body excreting the excess riboflavin and water-soluble vitamins. Some people with very sensitive stomachs may notice mild digestive discomfort when first starting supplementation, and taking it with food usually resolves this. A very small number of people report mild skin reactions or acne-like breakouts with very high doses, particularly from certain forms like cyanocobalamin. Switching to methylcobalamin typically resolves this. The bottom line is that B12 has an exceptional safety profile, and the risks of taking too little are vastly greater than any risk from taking more than you need. Here is what I want you to do starting today. For the next 30 days, I want you to try 1,000 to 2,000 micrograms of methylcobalamin B12 in sublingual form, taken each morning. During those 30 days, I want you to pay attention to a few specific things. Notice your energy levels throughout the day. Notice whether your thinking feels clearer, whether it is easier to find words or follow conversations. Pay attention to your mood and whether you feel more emotionally steady and motivated. And if you have been experiencing any tingling, numbness, or discomfort in your hands or feet, keep track of whether those sensations begin to change. Give your body 30 days and then assess honestly how you feel. I have had patients come back to me after doing exactly this and say things that I will never forget. One woman in her late 60s told me that after years of feeling like she was thinking through thick fog, suddenly the fog lifted. Another patient, a retired gentleman who had been struggling with fatigue for so long he thought it was simply what getting older felt like, told me he felt genuinely like himself again for the first time in years. He said he felt younger, not because B12 is some kind of miracle cure, but because his body finally had what it needed to function the way it was designed to function. That is not magic. That is nutritional medicine working exactly as it should. The core message I want to leave you with today is this: vitamin B12 is one of the safest vitamins in existence. It is also one of the most essential, especially as we age. The greatest risk you face with B12 is not that you will take too much of it. Your body is perfectly capable of handling the excess. The greatest risk is that you will not take enough, and that deficiency will slowly and silently affect your energy, your mind, your mood, and your nervous system in ways that significantly reduce your quality of life. You deserve better than that. You deserve to feel well. If this information has helped you see things differently, I would truly love to hear from you in the comments. Tell me your experience with B12. Are you currently supplementing? Have you noticed changes in how you feel? Have you been told your levels are too high or too normal? Share your story because your experience might be exactly what someone else needs to read today. If you know someone over 60 who is dealing with unexplained fatigue, brain fog, or nerve symptoms, please share this with them. It could genuinely make a difference in their life. And if you want to keep receiving practical, honest, patient-focused health information like this, make sure you are subscribed. I am here for you, and I will keep showing up with the information you deserve to have.